Hi, good evening, everybody. Welcome back to another webinar. Here I have with me is Dr. Yong Junina, who is a consultant pediatrician. She has her own practice. Where is about is your practice, Yong?
I'm currently based in Mutiara Damansara.
Would you rather I call you Yong or Junina?
Doesn't matter. Normally people call me Yong, but now a lot more people call me Junina.
Junina. Okay.
Yong is fine.
So I think that this is a very interesting talk because you are actually looking for warning bells in children, right? And maybe you would like to start your lecture now?
Okay. Hi, good evening, everyone. This is not meant to be a serious lecture on developmental pits, not bedtime story quite. This is just, as doctors, sometimes you see children
Do you
in our
mind
practice.
muting yourself when you come in, please? Thank you. Okay.
Sometimes, when you're in your practice, and it's not meant for pediatricians as well, but usually general practitioners who see kids by the way, and sometimes you know that something's not quite right. Or even if they come for cough and cold, you wonder if there's something not quite right. And this is just a little light-hearted way presentation just to say when things are not quite right and when you should be worried about that child. Because children is essentially are innocent and they are very trusting. They trust the adults around them, they trust people who care for them. And they rely heavily on us adults as caregivers or doctors to decipher their expressions, especially when they're babies. Their cry tells you whether they're hungry, they're wet, they're angry. You can get scolded by a 6-month-old, trust me. And then whether or not, they're active or not active tells you something as well. Because they can't speak, they can't describe what they feel. So we're the ones who have to see them and interpret what it is that they're trying to tell us. Okay, a child's duty is to play. And they should be allowed to play freely, to run in the park, to not have to worry about things because we're there to care for them. They're allowed to be creative. That's my son in a box because he says, now I'm living in a box, I'm living in a cardboard box.
That's your son in the box.
That's my son in the box. He's grown up now. He can't fit that box anymore. But yeah, that's him. And that's my grandnephew playing Lego on my carpet. Just to show that, they're supposed to be creative. And an ideal childhood should be one that's carefree, can eat, exercise, run around, and be creative. The same son is building a robot there. And above all, they should be loved unconditionally. It should not be, if you do this, I don't love you. Or if you don't get number one, mama won't love you anymore. It should always be, I love you no matter what you do, but I don't like this particular behavior of yours. It should not be, if you kacau that thing, I don't love you. Or if you're naughty, I don't love you. No, we should never ever threaten a child with love. It should be, I love you, but I really don't like that behavior. Can we change that, please? Don't do that. But I still love you.
Not create a sense of insecurity.
Yes. Because if you say, if you do that, I don't love you, then the child goes, oops, what else, can make mommy not love me anymore? And the child will grow up feeling very insecure. Okay, what are the things that we should look for in the consultation room, especially? One is the quiet child. A 3-year-old, I just had one this morning, a 3-year-old came in with a mom, and he just sat there still. And mom said he'd been coughing. So you worry. A 3-year-old should not be sitting quietly, especially in my consultation room when I have these creatures lying around. Normally they will be
right?
this.
Curiosity is part of them, right?
Then when I looked at him closely, he had suprasternal recession. He had hyperinflated chest. He was coughing. And when I listened to his lungs, there was no wheeze, but there was reduced breath sounds. So it was actually bronchospasm. So it was interesting.
He was exhausted?
He was tired. He couldn't breathe very well because he had bronchospasm. So I gave him nebulized salbutamol and Pulmicort. And after about 3 minutes, the fingers started twitching, the feet started tapping. He reached out for
Yes.
Lego pieces. You know, he was coming around. He was getting to be more active. And after that, he just bounded out of the nebulization room and came back into the consultation room. Quite a happy
Ba-
boy.
Basically, because they can't complain, right? They can't
Yes. Oops.
word
Yeah.
it in a way that it becomes a symptom.
Yes. But when they come to the clinic, the complaint is cough. Very often when you listen, there's no rhonchi. Sometimes we miss the fact that there's no rhonchi because it's so tight. It's a silent chest.
There's no air entry at all.
There's not much air entry. There's reduced
That's
breath
right.
sounds. Yeah. But the other reason for a child being quiet in the absence of a cough or respiratory symptoms is neurological. Is this child hypotonic? Does this child have developmental delay? These are the questions that should be going through our head when a 3-year-old doesn't move, or a five-year-old, maybe they're a bit mature, they just sit quietly. But when you see an 18 months old to 3 years old and they're not moving much, you have to start asking, is there something wrong with this child? And normally, the best thing to ask is the mom, is this child always like this at home? If the mom says, no, doctor, at home is a taiko, then you know things are okay. Not so bad. He's usually running around, or he was running around outside waiting for you. And you can hear through the walls, and it's not so worrying. But if the mother says, yeah, this child is always quiet, he doesn't move much, then you got to start asking, why is this child not moving much? Okay, so developmental issues are there to be explored. So you got to ask, what can he do? If this quiet child is, say, 20 months old, is he walking yet? Because the upper limit is 18 months. If she says no, was he born prematurely? The birth history comes in a bit to know whether we need to correct his age or not. And then we've got to ask other developmental milestones. Neurological issues like cerebral palsy, or if this child has other issues, also can be gleaned from the history. The other reason for a child not moving much is maybe the child is in heart failure. So he doesn't have much energy. So he's keeping quiet. Maybe the child, I think got to look at the color. So I've got a child with tetralogy of Fallot will be quiet during a hypercyanotic spell. But respiratory is the one that most often presents, because the child is beyond wheezing, the child is in respiratory distress, and it may be masked because he's quiet and the chest is quiet. So what I normally do is I get the parents to remove the shirt so that I have a good view of the chest. I can see where the recessions, if he's got recessions. Sometimes he's not even tachypnic because he's tired, but he's taking deep breaths. So not being tachypnic does not equal to everything is fine as well. Then I touched on walking just now in a quiet child. 18 months is the upper limit for walking in a child who was delivered at term gestation. If a child is born premature, then we've got to calculate the corrected age, because we've got to give him that discount. Yeah. So if a child was born at 32 weeks, he gets 8 weeks discount. That's 2 months. So if the child is at 18 months, the corrected age is actually 16 months. So if he's not quite walking yet, provided he's crawling, he's cruising, he's doing everything that a 16-month-old should, then he's fine. But you assess him based on that 16 months. And that discount, that handicap is given up to the age of 2 years. So at 7, you can't say, I don't want to do maths because I'm born prematurely. It doesn't work that way anymore.
Okay.
Right. Up to
If
2
a child
years.
doesn't walk at 18 months, after 18 months, that is delayed development.
That's delayed walking. That's delayed gross motor. Yes. Okay. So when they find that the child is delayed, you got to see, is he just delayed in motor skills, or does he have global developmental delay? Is it just the walking? Can he speak? Can he pick stuff up? What are his fine motor skills like? Does he turn when you call his name? These are the things that you got to ask, because when it comes to developmental milestones, you got to look at gross motor, fine motor, speech and language, and social skills. Does the child have cerebral palsy? Sometimes it's not apparent because the parents carry the child in, or the child is in a stroller, so you don't see it. But the birth history can give a suggestion that something might not be right. Maybe the child was delivered prematurely, or the child had a rocky neonatal period, a stormy neonatal period. Maybe the parents are already aware that this child has developmental delay. I've got a few who are on Ralph's tube feeding because they're severely delayed. These things are the clues that we can glean from the child to say that all is not well. If the child is otherwise okay, but there's something not quite right with the motor skills, motor development, maybe there's a brain pathology. Maybe mom can say, my child was well actually, doctor, until the age of 15 months. I mean, he was walking, but now suddenly he's not walking anymore. It's a recent onset. And then you got to see what could have happened, that led to that. So more history will have to be taken from the parents. The other thing to consider is, of course, Duchenne's muscular dystrophy. They present with delayed walking because they're hypotonic. And then you've got to examine the body to see whether he's got pseudohypertrophy of the calf muscles, how they stand up and whatnot. But if you're not a pediatrician and you're not comfortable, that's the time to tell the mother, look, I think I better refer you to a pediatrician for further workup.
How common is this, Duchenne?
Not very common. That's why I just mentioned it as the last one.
It's a genetic disorder, right?
It is. It's an X-linked recessive. So it's not common, but it's something that we have to remember when it comes to delayed motor milestones. Space occupying lesion. Children are not spared from tumors. So one thing we have to do is to test the muscle tone, test the reflexes. If the child is hypertonic, if the child hypertonic, is the child hypotonic? If it's hypotonic, is it central hypotonia? Is it peripheral hypotonia? If the child is hypotonic with brisk reflexes, then it's a brain issue. If the child is hypotonic with absent reflexes, it's a peripheral issue. And again, this is a time when if you're not comfortable, just refer the child, because sometimes the kid is not very cooperative when you're trying to do the examination. Somebody else might be able to do it. You can either refer to another pediatrician or to a pediatric neurologist, which very often the appointment takes quite some time.
So in this case, especially for because we are also broadcasting to some of the public.
Yes.
So in this case, right, especially if the mom is a first-time mom, they're not certain of, let's say, the milestone, it's even more difficult for us to determine the cause. They might even miss it, right? Just by, because we don't know. We didn't expect the child to be walking at 18 months. They may think, okay, my friend's kids are walking at 18 months. So it should tell them now that if kids don't walk at 18 months, it's something to consider seeking pediatric help.
Okay, the good thing is when you go for your child's vaccinations, the assessments are done because the blue and pink book given by KKM actually asks these questions about the child's development. Yeah, it's actually in there, and the mom is supposed to fill up the chart. And then when she sees the doctor or the nurse, the questions will be asked again. And normally most of us who administer vaccines to children will go through the developmental history.
Oh, okay. So it's quite
we measure the length.
Reassuring that.
Measure the length, the weight, the head circumference, ask about feeding, and then ask about development. And then we plot the parameters so that we know whether the child is thriving or not. Because if the child's weight is plateauing or falling off the centile chart, then we've got to figure out why, isn't it? And again, we ask about the milestones, so mom can actually discuss the milestones with the doctor at that point.
At this point of time, can you just explain what is milestones for all the viewers who are moms and the public? Of course, all the doctors would know what milestones mean.
Milestones is what you is basically that the level at which your child has developed at a certain age. So, for example, when should a child be able to roll over, meniarap? You expect the child to be able to roll over latest by about 6 months. If the child is born at term. If the child was born prematurely, we have to correct the age. That's when the chronological age is the child's age from the time he was born. So say date of birth is 15th of March. So when 15th of March the next year, he celebrates his first birthday. But supposing he was born prematurely, say at 32 weeks, then he's short by 8 weeks, which is 2 months. So when he celebrates his first birthday, his chronological age, his corrected age is actually 10 months. So we don't expect him to be able to do what a 1-year-old is expected to do. We expect him to be able to do what a 10-month-old is expected to do. So he may be able to sit at that time. He may be able to crawl at that time.
You can't say that he's slow because
can't.
he's premature, right?
Because he's premature. Yeah. Because the brain developed from the time the baby was in the womb and goes on to develop. Coming out is an inconvenience that happened, but the brain is still developing, is it?
See.
So you gave him up to 2 years to catch up. Having said that, today, most premature babies would have caught up a lot earlier. So I hardly have to do that correcting bit because most of them would have caught up. But we always correct it to give them the leeway.
They do catch up, right? But and the reason is because it's just the exposure, is it?
Yes. Well, if we do detect problem, most of these babies, if they're born prematurely, they will continue to have follow-ups in the NICU clinics. If they're born small, then they have the SGA follow-ups and their development is closely monitored. So supposing they don't move very well, then they will be sent for physio if there's any problem with the muscle tone. And later on, if they don't speak, they're sent to the speech therapist just to help them catch up.
But sometimes the external stimuli really helps, right?
Yes. If you've got parents who are exposed to what needs to be done, if they've got other siblings to talk to them, to play with them, if they're taken out, then yes, it will help. Or any form of stimulus, touch, cuddles, hugs, kisses, talking to them, that helps. Oops, why's my slide not moving? Hold on. Okay. The other one is a child who doesn't turn to name. You know, when you call a child, supposing the child's name is Adam, you go, Adam, the child will usually look because you're calling. Okay, but what if the child doesn't turn? You call Adam and there's nothing. My experience sometimes when you ask the parents, the caregiver, the parents will say, no, when I call, he turns. Okay, another one, oh, no. He doesn't turn when it's a stranger who calls. He only turns to familiar people.
Your voices.
And then the other one is, oh, try turning on his favorite video, doctor. He'll come to you. Or the last one is, oh, he just doesn't like you. That one was possible. That one was told to me.
Okay. Told to you by the parents.
Yeah. Once, many. No lah. I mean, it's fair enough. If the kid is screaming, then the kid's not going to turn when I call. I highlighted all this because you've got to see how the parents call. A lot of time is Adam, come here. The hand gestures are there.
Oh, I see. Okay.
So it's not actually the child responding to his name, but this. Can you see me waving?
Okay.
Yeah. It's like, come, Adam, come here. Oh, Adam, come to mommy. So it's actually the hand gestures that's calling the child, not the voice. And then when you respond, when a mother or father or caregiver says he will only respond when you turn on his favorite video, I've also done this. It kind of suggests that the child has been exposed to a lot of gadgets. He's been watching a lot of videos to the point that he is no longer responsive to his surroundings because he's immersed in the gadget, YouTube, other channels, TV programs. And
but this is very common these days, right?
That's why I highlighted it. Because it's not good. You see, when you're watching a video, A lot of parents tell me, but it's good because he's picking up how to count, he's picking up languages, he's picking up words. But it is not two-way communication, because when you're listening to a video, the video speaks to you. You don't have to respond. So you're just literally staring into the video. And if the child is only responding to his favorite video, it kind of tells you that that's what he's been watching day in, day out. And he has not communicated with anyone. The American Academy of Pediatrics recommends 0 screen time for children under the age of 2.
0 screen time.
Yep, no videos, no TV, except for FaceTime with a relative. That one is allowed because it's two-way communication.
Oh, so basically, and this is for the age below
2.
2.
And
And then
then-
do they increase the
Yes, 1 hour
huh?
and then 2 hours.
So 1 hour for 3, 2
About there,
hours
yeah.
for
4 onwards. Ideally, you don't want them exposed to any form of gadgets for more than 2 hours a day. And it's cumulative, you see. It's not 2 hours for TV, 2 hours for iPad, 2 hours for computer. It's A plus B plus C equals to 2. It is almost impossible now during the MCO because parents have to work. So what they do is they have to give the child something to entertain himself with while they carry out their work, because you don't get much time. Now that the nurseries are open, the schools are open, things are getting better. But at the time when nurseries were closed and schools were closed, parents were really hard pressed to keep their kids occupied because they had to do their work. That's when they ended up giving videos to their children. So if you notice that the child doesn't tend to name, call him yourself, get mom to call and observe how she does it. Again, if he doesn't turn around to name, see how much he can speak. Chances are he's also delayed. You have to work up for speech delay, and one of it is to check the hearing. Is the child not turning because he cannot hear? And also assess other milestones. Is the child delayed in other fields? That's why he's not turning, because he has not attained that age milestone yet. Okay, what about the child who doesn't speak? Comes into your consultation room, doesn't say a word. The first question to ask is it your observation or is it the parent's observation that he doesn't speak? It makes a difference. Because I had one child who never spoke to me. She's now 14, I think. She's only just started speaking to me a few years ago. Otherwise, she just whispers to mom. But I've heard her speak to her grandparents when she's waiting to see me outside. So I know she can speak. And this one betul-betul.
shy,
Shy, and yeah, she just didn't want to speak to me.
introvert, or doesn't like you. Painful to jadi doktor ni. Don't like us, ayo sedihnya.
Oh, well, you just play with them and then, they're fine. But this child is just quiet when she's out to see me. But now she's 14, she speaks more. But I have seen her speak. So I am convinced that she speaks well. I've heard her banter with her grandfather outside. But the next question is, you got to ask, is he completely mute? Is he a totally silent child? Or is he mumbling to himself? When he mumbles, what does he say? I've had children come in and they go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. A, B, C, D, E, F, G.
Because they're repeating what they watch on the video.
This is a child who's just repeating, or is this child exhibiting symptoms of autism? That's the other thing. Is he just doing something, autism?
Oh, I
Is
see.
he doing something repetitively, you see?
Oh, I see. So they do, oh, okay.
Obsession with something is one of the features. So again, these are the warning bells that should be ringing. Why is this kid coming in counting or just saying ABC? So you got to ask the mom, is this how he is always at home? I had a child who came into the who meowed at me.
Oh,
Meow.
and the reason? Watch
I
too
asked
much.
mom, can he speak at home? And mom goes, oh yeah, yeah, he speaks very well. He meows when he's nervous.
Oh my God. It can be so cute,
They're
but
very
it can
cute.
be worrying.
But when he settled in, he was more comfortable. He spoke. He spoke really well.
Sometimes are parents in denial when all these things that you observe is wrong? Is it
Not
difficult to tell the parents that something is wrong?
well, you've got to tell it nicely and not just blurt it out. You've got to ask them how the child is at home. And sometimes they'll show you videos. And it's true, the child is actually perfectly well at home,
Yeah.
singing, playing, you know. And even the meowing child actually started talking after 10 minutes. After meowing a couple of times, he started talking. And then you've got to watch them play, because if they're playing creatively, they're not just arranging things. Sometimes during play, they take on the roles of the characters they're playing with, because I've got a lot of Lego. So they
Uh-huh.
actually bring the elephant to the lion and they speak. Then there is a normal intonation, communication, and sometimes they forget I'm there and they turn and go, Mom, can you do this and this and that? And then you hear normal conversation.
Is it possible for a person to be mute without being deaf?
Mute can be elective mutism, where they choose not to speak to you, or they've got delayed speech for other reasons. So yes, they fall under delayed speech. And then you find that parents say, they don't call mama, papa, they don't say anything. So when you ask how do they tell you what they want then? Or they just take me by the hand and lead me to what they want.
I see. So this delayed speech, okay, there is no delay in the motor neuron,
It
motor.
can be. There can be global developmental delay, where they have delayed motor skills and they also have delayed speech. You can have isolated speech delay. You can have speech delay as a result of bilateral otitis media. And
Oh,
once you insert grommets, once you go for a hearing test, you find that they've got hearing impairment. And once you insert grommets to drain the fluid, then send them for speech therapy, they start speaking again. Or it can be part of the autism spectrum. So there are quite a few things to be considered when a child doesn't speak. But the most important is the hearing assessment first, because you can send them for speech therapy, but if they can't hear what the therapist is saying, then they're not going to progress. So once you know that the hearing is normal, then you move on to assess other things. So communication and social skills. When you ask a lot of times, when you ask, can your child speak? The answer is yes. Do you know, doctor, he can recite his ABCs. He can count 1 until 100. He can name the color. See, what color is this? Gray, right? See, what color is this? Okay, that's not communication. That's not speech. That is recitation.
sorry to disturb you at this point of time, but I find that the reason behind this is that I don't know about other races, but I find the Chinese race in Malaysia, parents speak to the child by just telling them, look at this. You see this yellow? It's not like they expect they know what I mean?
Yes, this is a new thing, because if you look back to the 70s, life was a lot more fun then. We were
Yes.
not expected to remember all these things from such a young age. Children were allowed to be children. And I think at the most, our mothers say, where did you go now? Don't do that, you know. But there was
Yes.
two-way communication. Buat apa pula tu? Jatuh
Yes.
nanti, you know. But there was communication. And children could play all day with their peers. So they picked up communication skills. I remember playing masak-masak with my cousin. Pretend play. I remember putting on shows with my cousins, singing and playing and entertaining our aunties, uncles, and grandparents.
Yes, definitely.
And we were not expected to read and do homework, do buku kerja and whatnot, from a young age. We were not sent for enrichment lessons, or sent for piano lessons, which I enjoyed, but not enrichment lessons per se. And we were allowed to discuss things. Nothing was so rigid. But again, in the 70s, everyone was more laid back. Traffic jams were almost unheard of. Parents were not harassed when they came back from work, having had to endure 1 hour in heavy traffic. They were not rushing home to pick their child up and then cook dinner and have dinner and go to bed and go back to work early the next morning. So things have changed. And along the way, we somehow developed this mindset that children had to be educated from a young age. And unfortunately, they were taught to memorize things, So we as medical practitioners have to keep reminding parents that no, we don't have to force your kids to learn colors. Just let them be. Even when my daughter was in kindergarten, I remember the teacher scolding her because she colored her apple purple. And the teacher said apples can only be red or green. We've got to allow the child to color the apple purple, the stars blue, and the grass red, because that's their creativity. We should not be limiting them to certain colors only for certain fruits and whatever there is that they wish to color. Once upon a blue moon, you can see once in a blue moon. So why can't a star be blue?
Yeah, why not?
Yes. But it's a child after all, right? Let
Yes.
them be. Let children be children. Let them build what they want to build and let them tell us. We shouldn't tell them, salah tu. You're wrong. How can you draw the elephant like that? Let them draw what they want to draw. Let them build what they want to build. This is actually in Legoland, this picture. Testing the strength, testing the building, because this one will actually shake to simulate an earthquake. So they're learning through play. This is the video I wanted to put up initially. Funny movements. Okay. Sometimes the mother will say, the child flaps the hands.
Okay.
Or rocks the body. Or they just have this little movement of fingers. Okay. And sometimes the parents have come to accept it, but when the child walks through the consultation room door, you notice this kind of repetitive movements. Okay, flapping hands, body rocking, banging the head, arranging things in a row. You say, can your child play? Boleh. What does your child like to play with? Kereta. My child loves to play with cars. Okay. How does your child? Where is my car? My car has gone away. How does your child play with the car? And the mother says, or the parents say the child arranges it in a row. That is not the way you should be playing with a car. Normally, children push the cars along. Vroom, vroom, vroom. That's how they play. Instead, they just line it in a row. How many cars? Okay, 6 cars, they will put 3 red, 3 green, or something like that. Or there's a sequence that they follow. That's not normal. That's not how you play with the car. Another way, and sometimes they say, oh, they like the wheel. So they lift the car up and all they do is turn the wheel. Nothing else. Okay. Those are also warning bells. We've got to look into it. Maybe the child's just curious. Maybe there's nothing to it. But if it is persistent, if the child doesn't have meaningful play with a particular toy, it's time to send the child for further investigation, to look further into it and to look at other signs. Okay, if you look at the immunization booklet given by KKM, at 18 months, there is this test called MCHAT. MCHAT is actually a screening test for autism. So when a child goes for the vaccination at 18 months, they should be screened using that MCHAT to see if there are any warning bells for autism.
So at 18 months, you can already pick up signs of autism.
Yes. Actually, you can pick it up sooner. You can actually pick it up earlier, but these are just the warning bells, and then you work on it to see what you can do about it. The sooner you identify, the better, because we can intervene earlier, is it?
So what are the signs of autism in a child?
Basically, most of what I've been mentioning, poor eye contact, keeps to themselves, repetitive behavior, not much of creative play or no creative play, funny movements of the fingers or the side eye or rocking of the body. Some kids have meltdowns, temper tantrums when they can't get something because they're rigid and they want. A delayed speech, so they can't actually tell you. Inability to point with the index finger or to follow the eyes, yeah, when they're older, usually. And then temper tantrums, I mentioned temper tantrums, yes, no speech, poor eye contact, funny movements, repetitive movements, and in some, they have self-injurious behavior or they injure other people.
See, when they're older,
It can be young, it can be at an older age, and because they are still developing, these symptoms actually evolve as well.
I see. So you
So
need to catch them really early.
the earlier you catch them, the earlier you can get them assessed, the earlier they can start therapy. Then they can go for the early intervention program. There are a lot of programs out there, both run by government and the private sector, that can help them. Because their IQs are not affected. Children with autism does not equate low IQ. It's totally independent of each other.
But it's just quite amazing to see that person with a normal IQ or even high IQ, how difficult it is to cope with the life if you have autism because you can't interact, you can't, you know,
That's why you need the therapy, because then they are taught slowly how to cope with other people, how to socialize, what is right, what is wrong. You know, we send them for occupational therapy, and then
no, yeah.
speech.
So what I'm trying to say is that with parents, I mean, all parents, all they want is the child to be really smart. They do everything to make the child smart, but then they don't realize that how important other social aspect of life is. How
That's
important
why that's
is.
why we have to be there to help the child, remind the other adults around them. Sometimes it's not the parents, sometimes it's other relatives. You know how when you go for gatherings, Chinese New Year, hey, how old your kid now? Huh? How was the exam? Huh?
Uh,
What number did he get? Huh? Enough to make any parent feel inadequate. Oh yeah, you know the other day I went to the other guy's house. Hey, the son is so smart, you know. He got number one and got into this school and that school. And the poor parents will be like, why am I doing that's not right? That my, such that my son cannot achieve the same level of intelligence. But that's not true. Those are learned skills. Exams are just that. You study, you take an exam, you get your results. And more often than not, the results are a reflection of your effort. Either
yes.
you work hard or you work smart. Okay. Sometimes you work very hard, but you don't get good results. Then we got to see why. Is it because you're not working right? Is it because you don't understand? Is it because of dyslexia? What's going on? Why are you not doing well? But at the end of the day, getting a string of A's does not ensure success in later life.
It's very
Not
important
getting,
to stress
yeah,
that.
not getting a string of A's does not equate to failure. And when you go for a job interview, nobody asks what you got for standard 6. Correct?
Maybe Singapore, yes lah.
Nah, don't think so. Nobody wants to know your primary school results. But your primary school results help to guide you to which school you can be admitted into. So it's stage by stage. But even if you're in your local neighborhood school, it doesn't mean that you're set up to fail, because it is all within you. And if you're admitted into a cluster school or a high performing school or a top notch boarding school, it doesn't mean that you're set to succeed. You can still fail. So the most important thing is the child must know that whether it's an A or an E, his parents will still love him. His parents will not kick him out because you got an E. And say that's the most important thing to a child. Do my parents love me? Okay, my parents love me. That's fine.
It is quite difficult to feel love these days in a modern family, don't you think so?
That one you got to ask my kids.
Okay, we move on then.
Okay. The other thing that you were asking about is if a child doesn't interact or play with other children, the mom will say, my child's a loner. Whenever he goes to school, he sits in the corner. Teacher says he doesn't mix with other people. He doesn't mix with other children. That's also another warning bell leaning towards, autism or autism spectrum, disorder. Okay. So these are basically behaviors or presentations of children in the consultation room, or you see another child somewhere, that should alert you that to the fact that maybe something is not quite right and warrants further investigation, be it through history taking or examination. That's about it.
Okay, so we will take some questions now. And Emmeline asked,
Yeah.
is taking glutathione supplements going to benefit autism?
No. No supplements have been found to be beneficial in children with autism so far.
So basically, what is the main reason that we are seeing more and more autistic kids?
I think one of the main reasons is awareness. Parents are more aware that their children are not developing as they should and are taking their children to see the pediatricians to be assessed. We are also more open talking about it. But having said that, there is indeed studies showing that there have been an increase in the number of children diagnosed with autism in recent years
The
around
reason
the world.
is, the reason because I try to look back on the times when I was a child. Okay? I
Mhm.
don't remember anyone in my childhood that looked as if they had autism.
Well,
But
when I was in standard 6, I remember there was a girl, because when I was in standard 6, they did away with streaming in primary school, and they
yes,
just jumbled everyone up, and you're just in random classes. So I suddenly had a classmate named Margaret who never spoke.
no, I mean I saw one or two that I thought maybe was a slow kid, but I don't see like the number of people these days. So many of my colleagues have autistic kids, and so many of my friends. Natia asked, can a child develop autism at a later age, say after 10 years old?
No, it usually develops when they're younger, by the age of 2 or thereabouts. But what may have happened is that the symptoms are well camouflaged. The child is able to cope, but something happens at the later age and he decompensates, or somebody notices it then. That's
Is
the
there
other
a
thing.
genetic explanation for this autism at the moment?
Yes, autism is a genetic disease, but I do not know which gene is on. I know that it is more common in boys
Yes,
compared to
definitely.
girls.
Another question is, can you explain more on development regression?
Developmental regression, there are conditions that causes a child to regress. Even children with autism, actually, a lot of parents describe regression in a way, because they say, oh, the child was very talkative when she was between 6 months to 12 months. There was ma, 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 ba, 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 ta, 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 and then suddenly the child goes quiet and the child doesn't progress. But there are also other metabolic conditions and genetic conditions that can cause a child to lose some of the skills they acquired earlier in life. So for example, maybe a child could crawl at the age of 9 months and then walk at the age of 1 year, but somehow at 18 months, the child stopped walking and eventually loses the ability to crawl as well. Those are metabolic conditions, and they need to be worked up by a pediatrician, preferably in a tertiary hospital, to see what the cause is.
Somebody said that Shah said, I know a student who always read T as I and vice versa. She's also confused with U and N. She will read U as N. Does it fall under dyslexia category?
Not necessarily. I mean, you've got to have their eyes checked, one, because the T and the I, but they can also, you also got to look at other reading parameters and other skills as well. There's actually a test that we can do to see whether this child has dyslexia or not. But if the child is actually coping well, reading well, then it's not something that's debilitating to the child. But check the vision, make sure the child doesn't need glasses, check that the child is not falling over the words because she's rushing to finish her work. But if all that has been tried and the child is still struggling, send the child to be screened for dyslexia, certainly.
Ayn asks, beside therapy, is there any solution to control autism from worsening or reduce the tantrum?
Okay, therapy is not just speech therapy or occupational therapy. There's also behavioral therapy that's usually done by psychologists, where they actually train the child to manage their own emotions. And the parents are also taught, yeah, you can use weighted blankets, for example, just to calm the child down or to wrap the child. And then as the child gets older, the child is actually taught how to manage, because sometimes when they are faced with certain situations, they don't know how to react, and that's when they have meltdowns. So the psychologist will train the child and how to handle. It's just like us, we sometimes fly off the handle. Some of us have better control of our tempers than others. And
Okay, I'm not one of them.
and we sometimes have that check mechanism within us. So, like, take a deep breath, count to 10. Oh, still angry, count to 20. Still about to fly off the handle, count to 100.
Especially with the kids, right?
I don't have that with kids.
Oh, you don't have, no, with your own kids.
Rarely. I normally have this with adults.
Oh, I see. I hardly
But
have.
with kids, if I come back from work and they're doing something and I think I'm going to get annoyed with them, I go in, take a shower, have some me time first. So that's my self-control mechanism.
I see.
So I'm not scolding them because I was angry with my MO at the hospital or something like that, you see.
Oh, at
So I
work,
go
I
home,
almost never
take a shower,
anyone.
and then come home, take a shower, chill, play Doom on the computer, and then chit chat.
I'm the other way around. Okay. Say what Inche Farid say what to expect in future if we don't recognize the warning signs earlier as stated before.
Oh, okay. If we don't recognize it earlier, when they go to school, usually the teachers start to identify the problems. And the teachers, in most cases, from the ones I've seen, will ask the parents to take the child for a checkup.
To take the child
For a
out of the
checkup.
school.
No, not out of the school. To see a doctor for a checkup.
Oh, I see.
Or when you go for your Raya gatherings, Chinese New Year gatherings and whatnot, some other family members may say, hey, your child okay? And then that may start the ball rolling. And the parents may start asking, why is that relative asking me if my child is okay? And then they will start looking into the matter.
Are there a lot of parents that is in denial? For example, child needs speech therapy.
Well, there will always be parents who are not ready to hear the fact that the child has a problem. And I think that is common and that is normal in the beginning, because all of us want perfect kids, right? That's our dream and aspiration, that our children are born normal, especially when you find that the child is born looking physically normal. So, and then to have someone tell you that there's something wrong with your child, it takes a lot for the mother and father to digest that. But having said that, I have a number of parents who come to me and say, doctor, I think there's something wrong with my child. Can you please assess my child? Yeah, and these are parents who have observed the children, spoken to each other, and decided, look, we have to do something. But it is not wrong either way, you see, because that's what makes life so interesting. There's so many types of people in the world.
Yes.
And yeah, It's for us to just help them along one way or the other.
So this what can you comment on the child that can walk, but she or he cannot stand up on his own?
We've got to check the muscle tone. This sounds like a child who's got weak muscles. You know,
So if you have weak muscle, you can't stand up, but you can walk.
no, depends on the gait. You got to see how the child walks.
Oh, I see. Okay.
Yes, because I'm not sure if the person asking is a doctor or a non-medical
These are all
person.
doctors.
Okay.
These are from our
Okay.
from Zoom.
If it's a doctor, then you got to look at whether the child has a positive Dower sign or not, because it could indicate proximal myopathy. It could be a sign of Duchenne's muscular dystrophy. So the child is walking. The definition of walk there is very lax, is it? Is the child walking with a normal gait? Is the child walking because the parents are supporting the weight? Is the child actually walking with a broad-based gait? Is the child actually waddling? There's so many, you know, the child is mobilizing, but how is this child mobilizing? You've got to check the muscle tone, you've got to check the reflexes, or is this child stiff? These are all the things. Is the child walking stiffly because of a hypertonia?
Okay,
So
somebody say,
yes.
okay. Are you sorry? Are you done?
Okay. The other question, no, I'm done. Yeah. I just noticed another question here.
Yeah.
If the child has chronic pain, which makes him unable to walk at the age of 3, can we say the child has developmental regression? No, because he cannot walk because of pain. So manage the pain and he'll walk again.
So it could be like, let's say, some children have arthritis, right?
Yes, or Percy's disease or something like that, and it hurts them to weight bear. The most common, okay, the simplest example is a fractured femur lah. He's not gonna walk, but he hasn't regressed. He just can't walk because it's painful to walk on a broken leg. But once that heals up, then we send him for a bit of physio to walk again, or maybe he walks on his own. But if it's chronic pain, then it's something more than a fracture. It can be rheumatoid arthritis, it can be avascular necrosis of the hyoid femur, and we've got to work through the pain and then get him to walk again.
How would we miss a fractured femur?
No, we won't. That was just an example.
Okay.
That's just an
scary for
example
a
of
while.
this. No, you can't miss a. But chronic pain will be more like arthritis or avascular Percy's disease.
Still's disease.
Like yeah, things like that.
So Emily asked how to act when a child with autism has meltdowns.
That's
Should
a
we let them?
difficult one. That's a
Let them
difficult
down?
one. The parents would, after a while, realize what works best for the child. Sometimes the more we talk to them, the more agitated they become. And then it's best to let them go. Just let them be. Once they settle, end of story, they're bright and sunny again. Some need a hug. Some need to be coaxed and comforted.
It must be very stressful for parents with autistic.
It is stressful for them because children with autism don't look like they have a problem. They are physically normal. They can have high IQ, normal IQ, low IQ. And the public may be judgmental when they have meltdowns outside, when they behave in a certain way in public. And that puts pressure on the parents.
Sad. Weeping us said, doctor mentioned earlier MChat. MChat is, I don't know what it is.
MChat is the one I mentioned to screen for autism.
Oh, I see.
You can do it at 18. The KKM booklet is at 18 months and 3 years. You can't use it after 4. No, there's actually an age limit to use MChat. So if you suspect that the child has autism, you can use the DSM-5 classification or ADOS, or you can go through the history to see whether the child has all the features or not, or CARS. There are other kits that we can use to assess for autism. But if you're in a general practice setting, general pediatric, general practice, then it's mostly through the history from the parents and your observation to see whether he fulfills the criteria or not.
Somebody asked, is being a picky eater a feature of autism?
Yes, it can be because
Really?
children, yeah, because it's texture or color based or odor based. So children with autism sometimes they won't touch stuff that are icky. So they won't touch Play-Doh, for example. They
Okay.
won't eat porridge. They will only
Oh.
eat crunchy food. Some children with autism, they won't eat colored rice. They will only eat white rice. So you
I
got to
see.
tell them this white rice and then everything else is on the side. Some children with autism, they will eat orange colored stuff. So like fruits, oranges, they can eat carrots, but they're averse to certain other colors. So
Oh.
it is interpreted as picky eating by certain people, but actually you give them the right thing, they will eat.
So they're picky because of their obsessive compulsive kind of.
Because of their sensory issues or because of their fixation on a certain color or certain texture.
I see.
So that's part of the therapy is to help them overcome.
Interesting. So Alvin asked whether is self-harming behavior is it very typical for autism or is it possibly ADHD?
ADHD is attention deficit hyperactivity disorder. So they tend to move around and they don't pay attention very well in class, but they don't hit themselves. They can injure themselves jumping from table to table, table to chair, chair to table, or when they play with stuff, but they don't typically hit themselves. Whereas children with autism can hit themselves, bite themselves, injure themselves.
They do that. Huh?
They do. Some of them do.
These ADHD children, their intellect, their IQ is also normal.
Independence of the diagnosis, yeah.
Amira asks, what activities are good for kids with autism to help them? She has a cousin about 10 years old. She keeps rolling books in her hands and playing phone.
Okay. Well, basically, you can get them to do, playing with Lego is good because they build something, they expand on it. Coloring is good. Reading is good. Get them to be creative because you want them to develop their imagination. Nothing repetitive because you don't want them to be obsessed with something. So the phone is a problem because they're just looking at the phone and that actually hinders creativity. So try to get them outdoors, physical activities, throw a ball, play football, run in the park, play in the playground, chit chat, go out, meet people.
So the more you expose them to social interaction, the better it is for them.
Yes.
And then my friend, I don't know you know him, his name is Ali. He has this horse special kids.
Yes. Where is it? Is it
He
the one
was,
in Denai Alam or is it the one near Palace of the Golden Horses?
I'm not sure where is his thing, but it helps them.
Yes, hippotherapy is good for children.
What therapy again?
Hippo. It's called hippotherapy.
Hippo, okay, hippo.
Yeah.
But they're
But
horses.
no hippopotamuses were hurt in it. Yes, in the process. It's called hippotherapy. It's been found to be beneficial to children with special needs. In fact, even children with Down syndrome have sessions, because I've had to sign a few. What they do is they teach the children how to groom the horses and they bond. So they touch, you see? There's tactile stimulation.
They ride also.
After that, they ride, yes.
Yeah.
And there will always be someone to guide them,
That's right.
to hold them on a leash. And that has been beneficial as well.
So this is like you gain confidence, you make friends with animals, and
Yeah,
of course,
animals, I suppose, are good for kids and adults. But we can't keep a horse in our apartments. So
You can't keep a hippo.
No, not the hippo either.
So Amira, check this out, the hippotherapy. Yeah.
It's HIPPO, hippotherapy, I think. That's right.
Where they play with horses and
Yeah.
it's
Bukit
quite
Kiara, I think, used to have it as well. The Bukit Kiara Club used to have as well sessions on Tuesday mornings, but I don't know if they still do or not.
I don't know where is Ali's one. I have to ask him.
I've got a few patients who've been going for this. That's how I knew about the two centers.
Yeah, he's telling me about it. I was quite surprised. Okay, so I think we have spoken for an hour.
Another
It was
question,
very
last one.
interesting. Yeah, very interesting. Another person asked, can we find or locate any development pediatrician specialists in our area?
You can actually check the government hospitals because I'm based in KL. I know where the KL ones are. Unfortunately, I'm not at all familiar with JB, but you could check with Hospital Sultanah Aminah whether or not they have a developmental piece. But most pediatricians actually will do perform developmental assessments because it's part of our training. It's just whether we want to go on and do the more complex ones, the more detailed ones, or whether we stop at the basic ones and then refer to the next level. And pediatricians will be able to identify children with autism or autistic traits and then decide what to do next and work out a child with speech delay and whatnot.
Okay, if there's no more questions, we will end here. Thank you very much, Junina.
You're
I'm
welcome.
so happy to have you here today. Finally, it's my first time meeting Junina here on Zoom, and I find this talk extremely interesting. Even though I'm not very keen on pediatrics at all, and but it's very very interesting, especially when you describe how the parents would respond to your questioning. So thank you, and thank you for coming. We have another webinar next week, but at this point of time, I can't remember what the title is. And I'm working on I'm working on CPD points. So maybe in June we will get some webinars with CPD. Okay, see you then. Bye. Thank you so
Thank
much,
you.
Junina. I'll
Bye.
see you. I'll chat with you later.
All
Thanks.
right.
Bye.